Okay, regarding GI pathology, gastrointestinal pathology, we have talked about the normal histology of each of those sections and the common organization of the GI tract. And regarding the oral cavity and the salivary glands, we have talked about the most commonest malignancy is squamous cell carcinoma. And regarding salivary gland tumors, we have extensively discussed what are the benign tumors and what are the malignant tumors, and what is the commonest tumors on the site. So there were tables and all those things in the lecture notes. Please go through those. This is a little bit of an important area. And then when going into esophagus, we talked about Barrett's esophagus, one of the important topics, and then the malignancies of the esophagus. Then when we went into stomach, we have discussed about the chronic gastritis, peptic ulcer disease, and gastric malignancies. And when we then moved on to the small intestine and the large intestine, we basically discussed about some inflammatory conditions, autoimmune conditions like celiac disease, and most important to the colon, inflammatory bowel disease, which encompasses Crohn's disease and ulcerative colitis, and how to differentiate them. These are common areas to question people on. And then this is one small tiny appendage, the appendix and the related diseases. We talked about the appendicitis, which is a type of acute inflammatory reaction, and related questions can be asked. And then moving on to the colon, we talked about large intestine, we talked about the tumors and the polyps, and also diverticulitis. So those are the topics that we have discussed about.